This presentation will provide information on the following: introduction to the voice, vocal hygiene, including appropriate volume, dietary considerations, and good practices for children, as well as tips for parents. The voice is created when the vocal folds come together and vibrate due to a buildup of subglottic air pressure. The vibration, in combination with articulators, such as your tongue, lips, and teeth, shapes the voice that we hear. Vocal pathologies may be present at birth or acquired during development. Common voice problems in children may be caused by phonotrauma, which is excessive or stressful use of the voice, and/or medical issues such as allergies or acid reflux. These issues can intensify the symptoms associated with voice pathologies. Common vocal disorders are benign lesions such as vocal nodules and vocal polyps, vocal strain, papilloma, laryngomalacia, subglottic stenosis, glottic web, and velopharyngeal insufficiency. Symptoms of the previously mentioned voice disorders may include weak cry, hoarseness or frequent laryngitis, scratchy throat, breathy or airy speech, or trouble being heard or understood. Vocal hygiene is the use and care of the voice by reducing or eliminating environmental and behavioral factors that may damage it. Good vocal hygiene is important because it helps prevent the development of disease and disorders. One example of good vocal hygiene is to stay hydrated. This is done by drinking at least 4 16-ounce bottles of water a day, and also avoiding drinking caffeinated beverages. If you consume a caffeinated beverage, drink some extra water to revitalize the vocal folds. Hydration is important because your vocal folds have to work harder to initiate and maintain voice when they are dehydrated. Dehydration also makes them more prone to damage. Some common locations where children are most likely to misuse their voice is at the playground, lunchroom, classroom, library, and while playing video games.
Another example of good vocal hygiene is to use an appropriate volume. This means don't yell or scream. Imitating characters and making sound effects can also put strain on the voice. To avoid these behaviors, a child should stand closer to the person they are talking to or use amplification if needed. Using an appropriate volume is important because increased vocal loudness can cause damage to the vocal folds, resulting in a voice disorder. This will cause changes in the child's voice quality and may also cause them pain when they are speaking. Be a role model to every child. You can encourage them to use good vocal hygiene in many ways, some of which include not smoking around them, going into the same room to speak instead of yelling across the house, and providing healthy diet and drink choices for them.
Our last example of good vocal hygiene is to make healthy dietary choices. This means avoiding fried, spicy, and high-fat foods. Chocolate and caffeinated beverages should also be limited. Limiting the amount of these foods is important since they can result in dehydration, fatigue, and excess energy, which can lead to poor vocal behavior. A simple vocal hygiene program includes identifying medical conditions, such as allergies or acid reflux, that can aggravate vocal folds, modifying behaviors that can cause stress on the vocal folds, like yelling or using a strained voice, relaxing the throat muscles, speaking slowly and clearly, and avoiding unhealthy food and staying hydrated. Some good vocal hygiene practices for kids include having daily quiet time and a good night's rest, encouraging hydration, eliminating exposure to cigarette smoke, discouraging making sound effects with their voice during play, and discouraging yelling or screaming. Whistling, clapping, or nonverbal signs are a great alternative to get a person's attention or when cheering for others. Moving closer to a person when talking is another helpful alternative. Some tips for parents to ensure good vocal hygiene for their children include making them aware of their poor vocal behavior. Observe how often, when, and where they exhibit poor vocal behaviors. Encourage good vocal behavior at home, school, and when hanging out with friends. Using a reward system may also be helpful, so your child maintains their good vocal behavior. And don't forget to be a good role model and use good vocal hygiene yourself.